Hi, I'm your host, Marsha Florence for Just Ask. Today's show, ladies and gentlemen, is Wayne County Oral Health Coalition. Hurry back and join us. Hi, and welcome to Just Ask Talk Show. Today's show, ladies and gentlemen, is Wayne County Oral Health Care, and we have the executive director herself, VeLisa Perry. Good afternoon, VeLisa Perry.
Well, thank you. How you doing?
I'm good having you here with me. So, VeLisa, you know what? I know about Wayne County Oral Health Care, but I want our viewers to know about it and your role. So, tell us a little bit about yourself as the executive director and Wayne County Oral Health Care.
Well, actually, I'm the executive director of United Health Organization that's been serving the community for over 60 years. The initiative, which is our newest initiative, is Wayne County Oral Health Coalition. And that's comprised of 65 members that are active members, and they come from all places in our community, grassroots, state, and also federal. And we come together so we can give resources to our community. We recognize that oral health has been kind of kicked out of the medical industry. When you go into the doctor's office, they don't even look in your mouth hardly.
Okay.
And so most of the problems you have is in your mouth and your gums. And if you don't recognize that up front, then other things will happen. So we bring the education to the community. We make it so much fun and so colorful that people come to our table. We are the most attended table everywhere we go.
Oh, yeah.
And we have people waiting for us. We have a waiting list, a year waiting list for us to come to people's events. That's because we give really good information and people can leave that location with information they can use that day. Our goal is to make sure we give information and they have the power to hand it down from generation to generation. And that's just simple tips on good oral health.
You know, you guys do a wonderful job because I want to thank you for always participating in our event, the Just Dance Foundation Health and Fun Fair. I mean, the table is just elaborate, you know, and you're right, it's so colorful, it just draws people there, and you get a chance to learn something about proper oral health care. A lot of people feel like, you know, I'm afraid to go to the dentist, I don't want to go to the dentist, but we're at a state-of-the-art level now that you don't have to be afraid. So, you know, do you guys actually educate people so, hey, you don't have to be afraid to go to the dentist anymore? They got this, they got that. So how do you actually approach somebody that says, I'm not going to the dentist?
Well, we really make it light when we interact with people. We don't stand behind the table, we come out front. And we have a mannequin that we actually show people how the proper way of brushing your teeth. I tell the truth. I didn't learn how to properly brush my teeth until I was 50 years old. And so once I say that, people are open to listening, and that makes a difference. And so we demonstrate how to properly brush your teeth. Then we give them the mannequin and show us. Because once you show us, we'll give you toothbrush, toothpaste, and the things that you need to do the work. And we also give information that people need to go to the dentist. A lot of times people don't go because they don't have a resource. So we give them the resources. A lot of community members don't have dentists or have insurance. And so we give them locations that they can go and get that service done without insurance and dollars.
It could be free or little to no cost.
It's free and little to no cost.
Okay, because you know, people, especially parents start off making sure that their children have proper oral dental care, but then they kind of slack up on themselves. You know, oh, I got to make sure my kids brush their teeth. It's not just brushing your teeth, it's teaching them how to floss and brush your teeth and not to drink so many sugary drinks and not to eat so much candy. So a lot of times parents put too much emphasis on children, but they don't think about themselves.
You know, that's so ironic. We did a program in elementary school, fourth graders, and a young man raised his hand. He said, I thought all old people didn't have teeth. And that spoke volumes. That was his reality, because back in time, people did not cater to their teeth. And so that will be handed down to generation. We want to change that. We want to stop it, and we want to give our children and adults the resources and the how-to, simple how-to. The things that we share at that table when they come is just amazing. People say, oh, I didn't know that. Oh, that's so simple. Just how to brush your teeth, properly brush your teeth in rotation, brushing your gums, because that's where the bacteria lies. I didn't know that. I show them how my mama taught me, and I'm proud to do that. My mama gave me the best. She gave me her best. But it's other ways of doing things that will extend the life of your teeth.
And that is so true. So now you guys go into the community. Do you go to the schools? Do you go to the senior centers? Where are some of the other places that you go besides my healthcare event?
We love coming to your healthcare events.
Thank
They stand in line. And I love when people stand in line, because they're hungry and they want to know and they want the resources. We go to everything you said plus. Anyone that have a mouth is for us.
Okay.
Because we go to the senior centers, and we talk to even people that don't have have teeth. They have gums, and they need to care for their gums.
Correct. Right.
And we show them how to do that, and we give them the resources. And the part that I absolutely love, especially my project manager, Regina Richardson, we go to the daycare where the 3- and 4-year-olds, and we teach them the proper way of brushing their teeth. They learn it just like that. They show us how to do it. We tell them about the 2 minutes brushing your teeth, 2 minutes twice a day, and go to the dentist twice a year. They got that. They got it. And then not only do we teach them the brushing your teeth, but we talk about reading for 20 minutes.
Wow. So let me ask you this. So when you say the daycare, you guys give invitations to come to daycares and actually do a demonstration for children?
Absolutely. We have, our phone is always ringing. We have so many people asking us to come to an event that they're having. Because of really what they recognize. You understand? They recognize the need of good oral health. We just started talking about oral health lately.
Right. So in essence, okay, when we talk about some of the things dealing with oral health, we're not just talking about brushing. We're talking about flossing. We're talking about rinsing. Okay. Anything else?
Yeah. Well, a lot of times, it's the method in which you do all of that. You brush your teeth in the morning and you floss at night. So you brush your teeth 2 minutes in the morning and you floss first and then brush your teeth at night. I've heard people say, well, I brush 4 or 5 times a day. That's not good for you, because it'll damage not only your gums, but your enamel on your teeth.
I've heard of that.
Once your enamel gone, the dentist can't put it back on.
Right.
And so we give people steps on how to do that. And it's very, very important to keep your oral health. People don't know that, especially young children, that the toothpaste you use, you don't swallow it, because it's really poison.
Don't scare them like that. You say poison, but I know it's got some, I forgot what they call it, something's in there that you shouldn't.
You should not swallow it.
I tell you what, we're going to hold that thought, and I know you're saying, well, what do we do with the toothpaste? We spit it out. But ladies and gentlemen, we're going to take a break and come back with some more good information from VeLisa Perry about Wayne County Oral Health Care. We'll be right back.
Sorry about that. No, I've been staying at my dad's place because of everything.
Here you go. It's your favorite. It's chicken noodle.
He's good.
Oh, wait, Dad. Wait, hang on.
Yeah, I know, we keep missing each other. I've been working out of my dad's house, doing some reading. I should be working out more. I know it's important to stay healthy. It's just, I don't have the time. I just feel like I'm drowning.
Your turn.
In tough times like this, we know it can be easy to neglect your own health and well-being.
Dad, it's the girls. Oh.
What kind of dance is that?
While you care for your loved one, you also need to care for yourself.
You look good.
Go to aarp.org/caregiving for free mental health and self-help tips.
If you store your guns properly,
I'll feel safer when I'm playing outside.
Safer when walking home.
And I won't have to tell my kids, this isn't a drill.
Never let your gun get into the wrong hands. Always lock it up.
And welcome back to the show. Now, ladies and gentlemen, a lot of you have dental concerns and are afraid to go to the dentist. But today, Executive Director VeLisa Perry is trying to fill you in on some resources that you can get for free or little to no cost. And so I do want you to take our number down, 1-800-323-5336. Give us a call so we can get your message over to Ms. Perry, or you can look at the credit roll and get the information as well. So I'm trying to get you to the point where, you know what, just don't teach your children how to take care of their teeth, but you as the parent and the grandparent need to know how to take care of your teeth, your gums, so that you can stay healthy. And so, VeLisa, a lot of times, you know, when you're right about, you can find out about conditions through the gums. So some people might have diabetes and don't know it, and it's discovered through the gums.
Absolutely.
Some have some type of oral conditions that come through the gums because they're like, oh, I didn't know that, you know, because I was smoking or drinking or whatever, and now it got a gum disease and caused the gums to weaken and the teeth fall out and this and that. So some people just think that's just hereditary, but that's not so.
Well, what makes it hereditary to them is a lifestyle handed down from family to family. But it's not nothing that's really, you know, something that you're expecting. It's just our lifestyle, and that's what happens in a family. And so we try to break that by giving education to the family, because we know once we teach someone something that they have the power to hand it down. And the proper way of brushing your teeth and oral health is something great to hand down from generation to generation.
Now, you know, you got people who like to smoke, and smokers don't think that, you know, their teeth are being affected by smoking. You got people who drink. They don't think theirs is being affected by drinking. But I know one thing for sure, sugary substance such as candy, pop, flavored juices, that's the most dangerous one. I would say dangerous, but it might not be the word choice of yours. But is that the one that sticks out the most that people should be aware of, that more sugary stuff you have, it causes early decay?
Yes. Because it lays on the tooth and it start eating through the enamel. And so I don't advocate for people to not drink pop or anything like that. But if you're eating sweets and drinking pop, all you have to do is to minimize the damage is rinse your mouth out. Not brush your teeth. You only brush your teeth twice a day. But rinse your mouth out with water. That removes some of the sugar, some of the acid. A lot of people don't know when you're eating, your mouth forms acid. And people want to brush their teeth directly after eating. That's not a good thing, because it will damage your enamel on your teeth.
Okay, so pause in between there. Okay, all right. So we've been doing it wrong for a long time.
Oh, yeah.
Okay. Okay, all right. Well, that makes sense. I mean, well, now the people who have dentures, do they need to be concerned about their gums because they have dentures, or if they have implants? Any concerns about that?
Well, your mouth is connected to your body. And so whatever happens to your mouth happens to your body. So if your gums is a part of your body, and if you're not caring for it and brushing your gums and gargling and rinsing with water, you're going to affect your body. Bacteria is bacteria, and it will travel.
Right.
And bacteria lays on your tongue. If you're not brushing your tongue, you're affecting your body. And I'm going to give you a little tip about brushing your tongue. People brush their tongue in a circular motion. I'll show you in the demonstration in a minute. But it's a one stroke to the sink and not around, because you're going to be pushing bacteria back down the body.
Wow. Okay.
Yeah.
So brushing the tongue. Some people like to do like this.
Yes.
All right. All right. So, well, that's something new. I know we have some photos we want to look at about some dental oral care that you guys perform. But let me ask you this. So, insurance-wise, if I don't have Blue Cross Blue Shield, Humana, and all that kind of stuff, but I got Medicaid, Medicare, is my dental covered?
Yes.
Okay.
In 2023, in April, the governor expanded Medicaid. So they've given you more service for dental. So anyone receiving Medicaid, they were receiving more service. Like now they can get crowns and they can get root canals when they could not before. They get a lot more services. They get deep cleaning when they were just doing surface. the root canal, they were just for children 16 and under. Now it's for all ages.
Wow.
Yeah.
I know our viewers heard that. Crowned. Okay, and that's
Expensive.
a good thing. Most people don't know. So, like, this photo here that we have up, and this young lady is being shown what? She looks so excited to be learning something. So is this one of your volunteers or techs?
Yeah, our blessing is that we have our partners of the coalition. We partner with Wayne County Community College, and that's a student from there. And so when we go out, we bring the students with us because actually they're closer to age to these children. And so this is a school that we went to just recently, and we were teaching the young children oral health, and they were interacting. And so the baby has her 2 minutes. She asked her a question: how many minutes do you brush your teeth? And she's saying 2.
Wow. Okay, that's nice. That is really nice. Okay, and so what do we have here now? This young lady is looking at what?
That's from our Rethink Your Drinking. You'll see that in a minute. What we do is we have a display of some of our favorite drinks, and we show people how much sugar is in these drinks. And so this baby is saying, she's telling us, the project manager asked her, what is the best drink off this table? And she picked that up. That's the water. That's how much sugar is in water, which is nothing.
Okay. Hi, Regina. Okay, so that was nice. Okay, and there's a demonstration showing this young child how to brush.
How to brush your teeth. We can show our young children from very young, 2 years old, how to properly brush your teeth, and they'll do it the rest of their life. When we go out to the community, this is an outside event, and this baby's about 3 years old, and we were showing her how to brush her teeth, and she did it for us.
That's wonderful. That's wonderful. And I think the younger you teach children, the better off you are when they're really young, so they don't start don't want to brush their teeth, don't want to drink the water. The younger, the better, because they get an early understanding. And they think it's a game.
And it's become normal.
Okay.
If they brush their teeth twice a day, starting very young, they'll do it the rest of their life.
Correct. All right. So I see you guys at one of your health fair events.
This is one of our health events at Wayne County Community College. And everywhere we go, people come, and old and young, and we're just showing people the proper way of brushing your teeth. And I'm so happy that young man is there because he's the head of the family. And if he learns how to properly brush his teeth, he'll show all his children.
Okay, that's great. And this has got to be
our partners.
The partners. I mean, this picture is so nice. I'm looking at everybody like, hey, Regina, on one end, you're on the other end. And are these students?
Those are students.
Okay, the people in the black jacket are Regina Richardson and VeLisa Perry, and those in the light blue shirts are all health students at Wayne County Community College. So that's your partnership.
That's our partnership.
Okay.
As our partnership. Over 20 years partnership with Wayne Community College. What we do, we go out to the community, and yes, we talk about oral health, but we also bring the young students out to the community so they can get acclimated to the people in the community, so they don't have the fear factor. They have the knowledge, but you really have to love people. And the people really have to feel the love and know that you care for them to open their mouth and let you care for them.
Okay.
So we teach a lot of soft skills to those students.
All right. So we're going to take a break, but I wanted, before we go, get everybody to see this sheet with the dental hygiene program clinic Monday through Saturday. So that's a wonderful thing, and got the number down there that they can call. Daytimes vary each semester. Okay, so this is the students who actually are assisting.
This is Wayne Community College. This is actually free. It's $10, and that's for the x-ray. They do deep cleaning. That's a $800 to $1,100 service that costs you $10.
Okay, I see it says teeth whitening, $70.
Yes.
So people actually want to get their teeth whitened.
A lot of people want to get their teeth white before they want to get them taken care of.
You see? Okay. Okay, well, I tell you what, VeLisa, we're going to go to a break. And ladies and gentlemen, get your pen and paper out. I always tell you that, because whoever you see at the Just Dance Talk Show has got a wealth of information for you. So we'll be right back.
I try to keep up with what these young people is doing and knowing.
I was at work and I just got a text from a number that I didn't know.
I sent him a text. He texts me back and say, "Who dis?" And I just thought that was the funniest thing.
The next few weeks, she just made fun of me, like would answer the door and say, "Who dis?"
Who dis?
Drop off a warm meal and get more than you expect. Volunteer at americaletsdolunch.org.
America, let's do lunch.
We asked and you answered.
We are proud to introduce to you our next recipient of Call Sam Cares.
My name is Marcia Florence. I'm the producer and host of the Just Dance Talk Show and the founder of the Just Dance Foundation. Well, the Just Dance Foundation was created to make sure that people who are in need, such as persons with disabilities and senior citizens, have an outlet that they can reach and receive services from. So we are an education and resource network that makes sure that if you are looking for a service, we can help find that service and make it much more easier for you to connect with them. So the foundation was created, and through that foundation, we produced the Just Dance Talk Show. In each show, we have our phone number at the bottom, and we get calls at 6 a.m. because we say it's a 24-hour number. So when people actually get up in the morning and they call, we answer the phones and say, Just Ask Talk Show, how can we help you?
My name is Phyllis Edwards. I am a board member with the Just Ask, and I am a partner with the Just Ask Health and Fun Day. The work that Just Ask does is to provide resources and connections to folks so that they can improve their quality of life. Whether it's about nutrition, mobility, exercise, and all the things that you need to really just have a quality of life, sustain your quality of life.
Well, we're on our 4th annual Health and Fun Fair, so the Just Dance Foundation decided to start to put together an event where we invite over 50 healthcare professionals to come under the umbrella at the Eastern Market.
It's an opportunity for people, for seniors and individuals with disability to come together and have just a day of fun. We don't have those opportunities, and so for people to come with their animal companions, in their support services, wheelchair canes. We have resources for them. We have food. We have face painting. We have music where you can dance and sing. And so it's just a day of fun just for them to come, relax, and have a good time.
We will definitely apply this to our wonderful event, and we're so grateful because we know that all the funds that we have gotten into will support our event to make it even bigger, better, as well as, it drives the message that there are agencies and organizations that are willing to support us along the way to make sure that we continue to grow. So we're grateful, very grateful.
You're supposed to leave the world a better place than what you found it. And so just leaving it a better place in terms of resources for seniors and people with disabilities is key for me. That's my driving force.
Just knowing that people are tuning in lets me know that we're on the right path of what's needed here in Michigan.
We are honored to recognize the wonderful groups, missions, and hardworking people making a difference in our community.
Call Sam Cares is our commitment to our community. And remember, your group, event, or organization could be next.
Head over to callsam.com/cares today and fill out the submission form.
We can't wait to hear all about it.
And welcome back to the Last Half of the Show. Now, ladies and gentlemen, we are trying to give you a demonstration or give you some resources here that VeLisa Perry brought with her. So quickly, VeLisa, we got to run through this. Let us know, what do we have here on this display, because you got a lot.
Yeah, this is some of our favorite drinks, and I just want you to see how much sugar is in the drink. This right here is an energy drink. That's how much, when you drink that energy drink, that's how much sugar you're going to get in there.
Wow.
This is Coke, and Pepsi's is just like that. It's only 12 ounces, and that's how much sugar you drink.
Wow.
This drink right here, people love. They drink 2 and 3 of those. This is how much sugar is in that drink. It's a lot of sugar.
Oh my goodness.
Would you drink this sugar?
No.
And we give this to our children. This is Kool-Aid. This is how much sugar is in that drink. And you wonder why they can't sit down.
Okay, I believe that.
It's a lot of unnecessary sugar in these drinks. And so what I'm asking people is, first of all, get the knowledge of how much sugar is in the drink before you drink them. I'm not saying not to drink them, but look what you're drinking. Okay. And I want to do a really good quick demonstration. When we go out, we show people the proper way of brushing your teeth. I didn't learn how to properly brush my teeth until I was 50 years old. My mother taught me up and down and sideways, and it got me through 50 years. But the proper way is, first of all, having a soft head toothbrush, and you take your toothbrush and you tilt it towards the gum line, and you brush in a circular motion. And you go all the way around your gums in a circular motion. And you do the same on the inside. Here's a quick tip. Most people don't brush their tongue, and the ones that do it incorrectly. When they brush their tongue, they do it this way. When you're going backwards, the bacteria is going down your body.
Wow.
So you brush one stroke to the sink, to the sink, to the sink.
Okay. Wow. So inside your teeth, you go circular motion. Inside, doing your gum, you do circular motion. It's always circular motion.
Yes.
Okay. And then when you brush your tongue, it's to the front, to the front.
Absolutely.
To the front. Now, some people have tongue scrapers.
That's great.
Same thing?
Same thing.
Okay. Don't keep going back and forth.
Nope. Bacteria
okay.
go down the body.
Okay. What about these toothbrushes? I see you got some beautiful toothbrushes. A lot of people are confused on what type of toothbrush, soft, medium, this and that. So I see that they're colored. So is that why they're colored?
They're colored for fun.
Okay.
The most important part is soft head. People think I'm going to get a hard head toothbrush to move some stuff off my teeth. If you're brushing twice a day for 2 minutes, all you're doing is removing what you put in there during the day. Please, soft head toothbrush, because if it's hard, you will destroy the enamel on your teeth over time, and also your gums. And your gums are important because that's what holds your teeth in your mouth.
Wow, wow, okay. And what do we have here for flossing?
Flossing is critical. People don't know, if you don't floss, there's areas that the dentist can't get to, and if they can't get to those areas, then they're going to just decay. That area will decay, and then eventually that tooth will have to come out. What you want to do is pull your floss. You want to wrap it around your finger just like that. And then you go in between your teeth, and you make, once it goes in the teeth, you go a C circle, C. And then you go up and down the tooth.
Circle. Okay.
Yeah, and you go up and down the tooth, and that removes the particles that you can't get to with a toothbrush.
Okay, how many times a day should a person floss?
Once. They floss in the evening. They floss before they brush.
Okay.
The last brush of the night.
Okay. Wrap it up.
Well,
I want to thank you so much for joining us today. Will you come back and see us again?
I sure will. This was fun.
This was most definitely fun. So, ladies and gentlemen, I just want to say, you know what? You're going to hear more about VeLisa Perry and the Wayne County Coalition. So if you have, or coalition, so if you have some questions, look at our credit roll, get her information as well as ours. And I hope you enjoyed today's show, because I did. I bet you I started doing my dentistry different now, okay? Brushing my teeth dentistry. I'm your host, Marsha Florence from Just Ask, and what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask, just ask. I'm your host. Thank you.